This video provides instructions for how to complete a medical record note in Clinical ACE. A medical record note is a way to provide documentation that helps tell the clinical story of the patient. When would a clinician document a medical record note? Anytime information related to the patient should be placed in the electronic medical record that's not tied to a billable service. For example, a medical record note would be an excellent place to document a conversation related to services being placed on hold for a patient due to a patient being hospitalized. A medical record note would also be a great place for a clinician to document their efforts to schedule a new patient that has repeatedly canceled the appointment. For children who are enrolled in the North Carolina Infant Toddler Program, a medical record note is an excellent place to document challenges and obstacles to providing services prior to the deadline date established by the Early Intervention Program, and for documentation of communication with the Child Service Coordinator. To document a medical record note, go to the Patient section of the program using the navigation menu at the top of the screen. Next, locate the patient's name and click on the row to open the patient record. The patient record will default to opening to the Documentation tab. From within this tab, the user will notice a button for Medical Record Note. Tap the button. The Medical Record Note form will then appear. The first step is to indicate the date associated with the medical record note. The calendar at the top of the form will default to the current date. However, the user may change this date by tapping on another date on this interactive calendar. For example, if the user is documenting a conversation that happened yesterday, the date would be changed to yesterday utilizing the calendar. Next, the clinical user will enter text into the medical record note field, documenting the details of the conversation, interaction, or missed evaluation appointment. Once the medical record note is complete, the user will click the button to sign the medical record note. The action of signing the medical record note will place the document automatically in the patient's EMR with the specified date. The medical record documentation does not generate any billing or payroll because it should in no way reflect a billable service. This concludes the instructions for documenting a medical record note in ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.